Hi, everyone. Thank you so much for joining. My name is Alex. We are going to give folks a couple more minutes to join, and we're going to show a quick video while we wait for them.
Um,
We don't hear the sound, Scott.
Same. Is yeah.
I had incredible doctors and nurses and care providers that helped me navigate that injury and got me walking again. I want our money.
Oh, CalCare?
I do. I'm excited about it.
You are? What's something about CalCare that stands out to you?
Well, I learned that 45% of our healthcare costs per person in the United States goes to administration and middlemen. When I was 18, I suffered a catastrophic accident that left me paralyzed. And I had incredible doctors and nurses and care providers that helped me navigate that injury and got me walking again. I want our money to go to health care, not to middlemen and not to for-profit insurance companies that are traded on the stock market. They denied my sister's cancer treatments last year. I'm all in for CalCare.
What's a doctor?
That's me. It's someone who takes care of me when I'm sick.
What's a nurse?
It's someone who helps the doctor.
What's a middleman?
I don't know.
When the Luigi Mangione thing went down, my Canadian friends were like, oh my God, like what is going on with the healthcare system? Like how crazy is it actually down there that something like that would happen? It's like, well, it's not that crazy. You know, you just have to know the difference between your copay and your co-insurance and your deductible and your out-of-pocket max, right? And your deductible is what you have to pay with cash before your insurance kicks in. And then that's when you pay a percentage of that, which is your co-insurance until you hit your out-of-pocket maximum. Which is technically the maximum amount of money that you'd ever have to pay in a given year, but it's actually not because you're also paying monthly premiums similar to car insurance, right? And sometimes your employer will cover a percentage of those, but it's only a percentage, it's not the whole thing, right? And then you're thinking, okay, well then like what happens with my family? And that's a really good question. If you have a family, it's a new deductible and a new out-of-pocket maximum. You have to recalculate all that math until you figure out how much it's actually going to cost you in a year, and it's really hard to budget for that. But the IRS is like, don't worry, guys, I got you. I got you. We have something called an HSA, and that's something where you can put. It's a health savings account. That's where you can put pre-tax money into a health savings account that you can then pay for your copay and your co-insurance and your deductible and your out-of-pocket max, right? And it's like you get it at a discount because it's pre-tax dollars, right? You can only get that if you have a high deductible plan. And if you don't have a high deductible plan, you can only do it with a federal savings account, which is similar to the HSA, right? Put pre-tax money into a bank account, and then you can pay for the co-pays and the co-insurance. Is that it disappears if you don't use it in a given calendar year? Does your back hurt? Does your back hurt?
Hey, Daryl. What's up?
Just finding out that America spends twice as much on healthcare as other countries. The average is 6,000 per person, and we spend 12.
That's irresponsible, especially considering our life expectancy. Have you seen this?
Turks and Caicos is ahead of us.
Do you think life expectancy is higher or lower than the average for Black folks in our country?
Let's see what other countries with fun names live longer than us. Wallace and Petuna. Is that a cartoon? You mean animated people live longer than us?
Oh my goodness. Comedy, but so true. So true. Thank you so much, Alex, for collecting those bits and producing some of them. And thank you, Scott, for putting them all together for our presentation tonight. Hello, everyone. I'm Erica Ferriston, she, her pronouns. I am the chair of Healthcare for Us, a nonprofit, all volunteer organization dedicated to guaranteeing health care as a human right in California and fighting the larger fight for health care justice. A couple of housekeeping items. This meeting is being live streamed, I think, on YouTube right now, and it's also being recorded. So we ask that you please mute yourselves. And while we do love to see your gorgeous faces, we ask you to turn your video off if your background becomes distracting. The format for tonight is we're going to have a presentation followed by a Q&A. The meeting will end at about 8 p.m. We will keep the Zoom open for another 30 minutes after we officially end in case there are other questions or things people want to share or just chat. And I am looking out and I see we have a wonderful mix of people tonight. We have those who have been holding down this movement for decades, who are veterans, who could be up here giving this presentation. And we have people here tonight. We're so excited you are here who have never really heard of CalCare and aren't familiar with the concept of single payer healthcare. So we're glad you're here, and our presentation caters to everyone here tonight. So thank you for that. And we're going to go ahead and drop links throughout the meeting, links to resources that will be helpful. If you want to go back and listen to something that you missed, it is being recorded. We're going to send out an email tomorrow with the link to that recording. It's also going to be up on our website. So if you have any friends who couldn't make it tonight, please feel free to share the email or send them to our website, healthcareforus.org. So I want to take a minute. I need to change my view so I can see everybody. I was looking to see if we have any advisory board members here tonight. I don't see any. So I want to just say a quick hello and introduce our board members. I'm going to start with Scott Peak, our treasurer. Scott, if you just want to give a wave. Dennis Resendez and Paul Newman working our tech. Thank you so much. Miss Sheila Bates is on with us. And we have Carol Fodera, who leads our membership and puts out our newsletter. We have Alex. You will be hearing from Alex later on in just a few minutes. And she is also our recording secretary. And we have, of course, co-chair, political wife, Gina Viola. Gina, I'm passing the mic to you.
Thank you, Erica. Good evening, folks. My name is Gina, and yes, I am Erica's activist wife, and I use she, her pronouns. Even my children introduce Erica this way now. So, thank you for being with us tonight, folks. Just a quick shout out to all that's going on, all that we're holding in our country, in our state, in our city, in our county. It's really difficult to talk about healthcare without talking about why we don't have healthcare. And we don't have healthcare because of racism, right? We didn't want to give healthcare to Black folks in America, specifically anti-Black racism. And we see that playing out, with Palestine. A nod to Aaron Bushnell. I came across his quote again today. This is what our ruling class has decided will become normal. We have to fight against that. The Supreme Court ruling with the ICE raids, the policing, over-policing in our state violence, unhoused people. The unhoused number in the United States hit 700,000 in the latest count. It's the highest ever recorded, 150,000 of those being children. It's all connected. We know that we don't have health care, so they can specifically keep funding all of the things that keep us so unhealthy, like the war machine. So we're so grateful to have you here tonight. Thank you for your time, your intention. We are inviting you in to fight with us to make CalCare and single payer healthcare a reality. Thanks so much. Passing it to Sheila.
Hi, everybody. My name is Sheila Bates. I'm glad to be here with all of you. We just really want to quickly ground ourselves and allow ourselves to let go of what we were doing before, of the rest of the day, and allow ourselves to, one, have a moment, but two, also just ready ourselves to be in this meeting. So if you all could just find yourself in a comfortable position, if you can, plant your feet on the floor, lighten your gaze. Just notice your breath, notice your heartbeat. We're grateful that you have both of those and that there's breath in your body, that blood courses through your veins. And we are fighting for a world where that is something that nobody has to ever doubt whether or not they're going to have the care that they need to be able to continue to do so. As Gina just uplifted all of the things that we are dealing with, from ICE raids to genocide in Palestine, to just all the things that we are individually fighting, just to honor that for a moment and allow yourself to just settle, drop your shoulders, pull them back, lengthen your spine, allow your lungs to have more room to expand. Try and sit up just a little bit taller, root your bottom and your hips into the ground, and allow the crown of your head to reach up to the sky. And I just want you for a second to just think about the world as we deserve it to be. The world as it's fitting for all of us here, including our youngest member of Healthcare for Us, Gus. A world that is worthy of us, a world that is reflective of care, of compassion, of love. What does that look like, feel like, smell like, taste like, sound like? Immerse yourself in that for just a minute. Breathe it in. Let it settle deep into your cells. Let it become one with who you are, how you fight, how you speak, how you move, how you live. And I'm going to be quiet for a moment, and I just want you to just go inward just for a moment. And then we'll all come back to the space and take a collective breath, and then we will move forward with our meeting. I invite you to join us all in a collective breath. I want you to really focus on inhaling through your nose, hold it, and then exhale. We're going to inhale for a count of three through our nose, hold for a count of 3 through our nose, and then exhale for a count of 5. Inhale, 2, 3, hold, 2, 3, exhale, 2, 3, 4, 5. Allow your body to soften. Drop the tongue from your roof of your mouth because it's probably glued there. Unclench your jaw. And we're so happy you're here. We're so happy you're in this fight. And we welcome you. And we look forward to having a world where that healthcare is a reality for Californians.
Thank you, Sheila. Hi, all. My name is Alex. I use she, her pronouns. I'm not sure if I'm supposed to be choosing the spotlights. Hi, I'm Alex. I use she, her pronouns. I'm on the board of Healthcare for Us. I'm also a mother of 2, And my son Gus is on tonight, as Sheila gave a shout out to him. Hi, buddy. I'm so glad you're here. In my career, I am a bookkeeper and a CFO for small businesses. So that's the lens that I look at our work through. What is the cost to small businesses? What is the cost to us? What is the cost of it all? So I'm going to start the part of our presentation tonight that has to do with the problems of the current for-profit system. And one moment to get my slides. We are going to start with the cost of the current for-profit system on small businesses. So each year for companies that provide healthcare to their employees, they have to renew their insurance policy. So every spring, I get a report from the insurance reps that lists what the quotes are for the renewing policies for every provider that there is in California. This is a sample of the info that we got. I chose on the right in the second column, the cheapest option, HealthNet, all the way to the most expensive on the left being Aetna. So for a single employee, the minimum cost of insurance premiums this year was $7,700, and the most expensive was $13,000. For an employee who has a spouse and children, the cheapest was $26,000 and the most expensive was $45,000. I've also included the prior year rates for Blue Shield in 2024, as well as the rates for Blue Shield 2025. And so you can see the increase in the policy costs from the prior year were 6%. And just as a side note, there's nothing that regulates this. So insurance companies can raise their premiums as much as they want, and there are no rules and no one to stop them. Also, this does not reflect deductibles and out-of-pocket costs paid by the employees. It is only the premiums for medical coverage. Vision and dental coverage is not included in these numbers. Now let's look at what is the cost of health insurance as a percentage of employee salaries. So if we see a single employee making $100,000 a year, which is not the median income here in Los Angeles, but for round numbers, a single employee being paid $100,000 a year, their premium with vision and dental is $9,300. That's 9% of their salary. Up to a family with 2 or more children at $150,000, their premium is $35,000 and it's 23% of their salary. So this small business is paying $200,000 a year for health insurance premiums alone. Per employee, the insurance costs are between 9% and 23% of their salary on top of their wages. Monthly premiums for this policy were 6% higher this year compared to last. So what that meant was an increase of $600 for an individual, and for a family with children, the increase was $2,000. So now let's look at the cost of the current for-profit system on people with insurance. This is a separate client who is an individual. They are old enough to qualify for Medicare. You can see the plan name is the Medicare Supplemental Plan. Their monthly premium is $311. So the total due here is $933. That's 3 months of premiums. This policy was canceled for non-payment, but I'm their bookkeeper. That's my job. So I know that this policy was paid every month. When I pulled at the thread of why was this policy canceled for non-payment, this is the screenshot from the Blue Shield portal. What they did was they refunded 2 months of payments. You can see each month was paid timely. They fraudulently refunded 2 months of payments, sent the notices to an old, outdated address that no one collected mail at anymore, and then they canceled the policy for non-payment. This client had several months prior been diagnosed with a serious medical issue that required 1.5 years of constant treatment in order for them to survive. So what was the consequence of this policy being canceled? The following month, they received a bill from Cedars for $29,000. Now, this was just for 1.5 months of care. So on an annual basis, without the supplemental policy, they would have paid $250,000 to stay alive or gone bankrupt, as we'll go into next. But again, the policy was canceled fraudulently, and this is what it led to. So we know that we're spending a lot in America. How does America compare to other nations in its spending on healthcare? On average, other large, wealthy countries spend about half as much per person on health as the US. So you see the blue line in the middle is the average that the other high-income nations spend per person per year on healthcare, and that's around $7,300. The green line at the top is the US, and we are spending almost double at $13,432. But if we're paying more, we surely must be getting more. We must have better care. We do not. Our maternal mortality rate is 3 times higher than the average of other high-income nations. If we look at it in this bar graph, you can see they've separated by country, but then also on the right, I underlined in red, it's broken down in America by race. So per 100,000 live births, our maternal mortality rate is 22 deaths on average in the US. But if you're Black in America, that number is 49 deaths per 100,000 live births. It's more than twice the average. So this is one example when we talk about the American healthcare system as medical apartheid. This is an example of the racial disparities in our current system. Also, they did a review in 36 states of maternal mortality rates, and they found that 84% of them were preventable. This is global life expectancy at birth. It's from the CIA.gov. And of all the countries in the world, we rank 49th in terms of our life expectancy. Healthcare costs are the #1 cause of bankruptcy for American families. The bar graph shows the top causes of bankruptcy, and medical debt is more than twice what the second leading cause of bankruptcy is. Also, as a side note, medical debt in America now exceeds all credit card debt. That's how bad it's gotten. And we can see from the bill from Cedars for $29,000 how quickly that medical debt can pile on to someone. Ooh, well, who profits from this? Total CEO compensation in the last 10 years. So this is just 7 of the insurance providers, and this is the compensation for one position. $1.7 billion over 10 years for one role at these companies. How many lives would that money have saved? How much care would that have provided for our people? And to put it in perspective, of the difference between 1 million and 1 billion. 1 million seconds is 11 days. 1 billion seconds is 33 years. That's how much wealth is being extracted from our people in order to profit the capitalist corporate billionaire class. So when we think about why are we spending twice as much as the average of other countries, this is why. A small number of middlemen sit between patients and their treatments. In 2022, their combined revenue equated to 45% of America's healthcare bill, up from 25% in 2013. 2013 is not a random year, right? Can anyone think or put in the chat of something significant that happened in American healthcare in 2012?
The ACA.
Yeah, the ACA, that's right. Thank you so much. So in 2012, the Affordable Care Act passes. When that passes, which let's be frank, was modest progress, right? But still significant legislation. When that passed, insurance companies then had to figure out how are we going to maintain and increase our profits in the wake of the Affordable Care Act. The answer was increased premiums, increased denials. And what that resulted in was an increase to them taking 45% of the pie in just a 10-year period. OMG, or as Gus says, OMG. What's next? What could be worse than having the highest maternal mortality rates, systemic racism making outcomes twice as deadly for Black folks, everyday Americans going bankrupt so CEOs can bank billions, and being 49th in global life expectancy? Well, this last July, they passed the One Big Bill. And so, as we're thinking of looking back and saying, what are the changes that have occurred in the last 1 to 2 decades that have made healthcare worse in America? And if we look at where we are now, is it going to stay status quo where it is? Is it going to get better, or is it going to get much, much worse? And the answer is it's going to get much, much worse unless we interrupt it. The big, brutal bill means that 17 million Americans are expected to lose health insurance coverage by 2026. And 1/3 of Affordable Care Act enrollees, approximately 16 million people, will lose access to affordable health care coverage. The ACA subsidies are set to expire at the end of this year. And if they aren't renewed by Congress, which at the moment it looks like it won't be, then the projection is that insurance premiums for folks who are covered by the ACA will increase up to 66% next year. The big brutal bill cuts $1 trillion in Medicaid funding. Rural hospitals will lose more than $50 billion in funding. The big brutal bill cuts to Medicare will result in higher costs and fewer benefits. It strips Medicare eligibility from certain groups of legal immigrants, even if they've paid Medicare taxes for decades. And it blocks assistance for low-income seniors. This is just the short list, of course. The Center for American Progress estimates that an older couple with an annual income of just $21,000 could face up to $8,340 in additional healthcare costs per year. Uh-oh, but wait, there's more. Medicare Advantage privatizes Medicare for profit. So for anyone who doesn't know what Medicare Advantage is a privatized corporate Medicare plan. When you enroll for Medicare, you can choose Original Medicare, or you can select a Medicare Advantage plan that will be administered by a private corporation. One of the things that's important is that Medicare Advantage is not new, right? Medicare Advantage was created under a different name before I was even born. But enrollment was nearly zero for a few decades. People didn't start enrolling in this until after I was old enough to vote. So again, if we're looking at what are the shifts in our healthcare system over the last couple decades, we went from nearly zero enrollment in Medicare Advantage to, in 2023, more than 30 million people enrolled in a Medicare Advantage plan, accounting for 51% of those eligible for Medicare. By 2023, those enrolled in Medicare Advantage plans are expected to rise to 62% of all eligible beneficiaries of Medicare, according to the Congressional Budget Office. In 2022, researchers evaluated data from a large insurer's claims and found that 1/3 of enrollees faced one or more service denials each year. Approximately 15% of the 5.6 million denials, let's just sit with that for a second. 1/3 of enrollees, 5.6 million denials amongst 30 million people. Approximately 15% of the 5.6 million denials stemmed from Advantage policies that were more restrictive than Medicare coverage, suggesting that some Advantage policies deny care that would be covered under Original Medicare. This was corroborated by the Office of the Inspector General, which found that 13% of denials by Advantage plans actually met medical criteria. So if we look in our country, there are multiple ways that the corporate capitalist class extracts wealth from the middle class. This is one way that they do it with healthcare. Insurance premiums are another. In public education, charter schools, the larger conversation that people are trying to have about canceling Social Security. As Melina Abdullah says in BLMLA, they pilfer the public purse. And this is one way that they're doing it in Medicare, but they're doing it at the expense of our senior citizens. So publicly funded healthcare would help small businesses, protect senior citizens, reduce bankruptcy and poverty, address racial disparities, put healthcare professionals in charge of our care. It would improve health outcomes, and it would cost less. And the note that I'll end on before I pass it to Carol, who's going to follow up our problems section with the solution section. But the last thing I'll note is 18 of the 19 high-income countries on the planet provide publicly funded single-payer healthcare to their people. America is the only country that does not do that. And I'll pass it to you, Carol.
Thank you, Alex. So now I'm going to tell you.
Carol, I think you're muted.
It looks like she froze on my end.
Oh, maybe she disappeared.
She's still here. I see her on the participants.
Okay. Do you have her slides, Alex? Do you want to do them, or I can
I'm
do
showing them right now. Can you see it?
Yes. Do you want to take this, Alex, or you want me to just go with it?
I'll go for it.
Go for it.
Okay, so Carol's section, hopefully she'll be back in a minute and I can pass it to her. But Carol's going to talk about CalCare, right? So we have a bill at the state level. It's called CalCare. It was introduced in 2024. It looks like it will be reintroduced again in the next legislative cycle. So the answer to all these problems is CalCare as the solution. This is decades in the works. The community helped to craft this legislation. We have a 1-hour Zoom on our website where we go through every single section of the bill. And so as Carol, I'll tell you a little bit about CalCare. CalCare is California Guaranteed Healthcare for All. That's what the act is called. It's sponsored by the CNA, which is the California Nurses Association, and it was primarily written by Carmen Consti, the lead regulatory specialist. CalCare is the gold standard. CalCare sets a new level of single payer and would be the most incredible foot for America to start off on, and California could be the mother of it. This legislation would enact a single payer system in California, starting with a policy bill, and it completely eliminates insurance companies from our care. These are the 7 principles of CalCare from the CNA, from the Nurses Association. The first one is universal coverage. Everybody in, nobody out. Everybody, regardless of race, sex, gender, origin of country, disability status, immigration status, marital status, age and income, everyone. You are a resident of California, you get CalCare. It's a single public program, single payer, publicly funded through progressive taxation to cover all necessary care in California, eliminating billions in bloat and waste and saving people thousands on their healthcare costs. Is Carol back? If Carol returns, will someone interrupt me? Okay.
Yeah, she's rebooting her computer.
Great. It has fully comprehensive benefits. So CalCare includes medical, dental, hearing, vision, mental health, prescription drugs, long-term care, and more. All decisions about CalCare or about care would be made between you and your doctors and your nurses, not by insurance companies and all of their millions of denials. You have the freedom to choose your care provider. Under CalCare, there would be no more in-network or out-of-network. You would have the freedom to choose any doctor or hospital you like, which is also incredibly liberating for people whose healthcare is tied to their jobs. CalCare is free at the point of service, so no more copays, premiums, or deductible. You go to the doctor's office, you give them your CalCare card, and you get the care you need. There's a just transition, which is funding and programs to protect and support. Oh, this thing popped up. Now I can't read it. any displaced workers in the insurance industry. And the last one is patient care based on patient need. CalCare saves money, and it is a policy bill that needs to become law first. So the bill states that the California legislature, A, admits that there are problems with healthcare and that Californians need change. Of course, it establishes a comprehensive universal single-payer healthcare coverage program and a healthcare cost control system. So if you want big pharma to have some regulations and stop overcharging us, 3 to 10 times or more what other countries pay for their prescriptions, that's part of CalCare. CalCare creates the CalCare Trust Fund. The CalCare program does not start until the CalCare Trust Fund has the revenues to fund the costs of implementing CalCare. More great things in the bill. There's an advisory commission on long-term services and supports. There's a public advisory committee. There's an advisory committee on public employees' retirement system health benefits. So we know that our teachers and some unionized workers have health benefits in their retirement programs. They are the people at the table who decide on how that is addressed as we move to CalCare. There's a health workforce working group, and then there's also the Office of Health Equity to address disparities in healthcare outcomes and in care themselves. Now I pass it off to Erica.
Thank you so much, Alex. Thank you for your presentation. Thank you for stepping up, doing Carol's part. And I see Carol just got back in. Hi, Carol. Welcome back. So yeah, I mean, this is CalCare is incredible. Just imagine if you had fully comprehensive healthcare for the rest of your life. What does that do for you right now? How does that change your daily life? How does that change your mood? Now, not only you have it for the rest of your life, your children have it, your parents have it, your loved ones have it, your friends have it, your neighbors have it. This changes everything. And this is why these board members dedicate time they don't have to working and fighting for this bill. And we are so excited that you guys are here tonight to fight for this with us. And this can happen. I'm going to tell you something. Just about every single social justice victory that we've had in the United States, it began at the state level. The 19th Amendment granting women the right to vote, that began with Wyoming, spread to 14 states before becoming law nationwide. The civil rights movement is often associated with the Federal Civil Rights Act of 1964, but the groundwork was laid in the states like New York, which enacted the first anti-discrimination laws. Other states followed. Then we had the federal action. Same story with marriage equality. Massachusetts led the way. More states followed. It finally became the law of the land. So now the time has come for California to lead the nation in establishing a free, publicly funded healthcare system for all. The time is now because we are at an inflection point. You know this, we see it. The people of this country are fed up with the chronic failures of a for-profit insurance system. We are all seeing thriving government-funded healthcare systems around the world that their residents love, and Americans are now demanding that same kind of care for us. The time is now because our CalCare trials in 2022 and 2024, they prepped us. They gave us the opposition's playbook. We know how to play this game. We cannot outspend them, that is true, but we absolutely do and can outnumber them. We outnumber them. We can outmaneuver them. The place is California. Why? Because I feel like the board could sing in chorus. California is the world's fourth largest economy. It is larger than Canada, Japan, and France, all with healthcare systems that treat patients, not profits. People love their healthcare systems there. So when anyone says we can't afford it, not true. We absolutely can afford it, and we must. The place is here because we've already built a strong people-powered foundation from which we are continuing to build on. We just came out of a summit on Saturday with organizations from across the state. All of these organizations are now back in their communities holding meetings, rallies, events, just like we are tonight to mobilize the forces for CalCare. So you're here tonight. People are elsewhere doing the same work all over the state. The time is now and the place is here because in 2026, two vital factors will align. Number one, it's an election year. And that is when we, the people, have the most power over our representatives. It is when they are running for office. It is when they are candidates. And the other significant thing that's happening in 2026, the mighty California nurses are bringing CalCare back. So we have the opportunity to send a clear directive to every candidate: no CalCare, no vote. So the point of this is to convey to you that victory is within our reach. History is on our side. We can follow the proven path of our neighbors to the north. Canada's national healthcare system began in one province, Saskatchewan, where a workers' movement, a third party, a workers' movement, they organized coffee clutches to educate and rally support people on a national healthcare system, or actually on the state healthcare system. Once that succeeded in Saskatchewan, no amount of propaganda from the medical industrial complex or the politicians could overshadow that success. And the two major parties were forced to adopt it nationwide. And that is the path before us. That is the path to victory. And this is where you can come in and make the winning difference because you are the heart of this campaign to spread the word across California about CalCare and about how close we are to winning. The opposition cannot dim a light that the people are shining, and Sheila is going to show us how to shine that light so brightly that the politicians will have no choice but to vote yes on CalCare. Sheila, take it away.
That's right. So we know that Newsom ran on and won on a campaign that included single payer healthcare, right? And as he trolls Trump, we're all seeing him right now trolling Trump and being touted as this liberal Democratic darling. I beg to differ. But as he trolls Trump, the greatest troll move would be to pass single payer healthcare, right? Not push forward crime of suspicion teams. We know that what suppresses crime is resources and people having their needs met, including having healthcare. It isn't just about protecting and saving Medicare and Medicaid and Medi-Cal as they're talking about in Congress right now. That's not all we need to do, right? That is what they're presenting as the solution, right? But we know that what really needs to happen is that everybody needs to be covered by single payer healthcare, and it does not need to be any income limits. It doesn't need to have any limitations that we have currently on these systems. It needs to be expanded to cover everybody. That is the solution. So if you are down with that, we need you to do a few things. Talk to others And what better place to do that than at, a casual party, right? Erica spoke about how that was a winning strategy in Canada. There is a poll that is about to drop that allows you to tell us how you want to tap into the work, including maybe attending Alex's party on September 14th at 10:30 until 12 o'clock. Throw your own party. If you want to know how that looks, I don't know, maybe come to Alex's party on September 14th at 10:30 a.m. Help with setup or cleanup. You can see how long that takes if you attend the party on September 14th at 10:30 a.m. Help fund a party, bring something. You can ask one of the hosts or helpers about this at Alex's party on September 14th at 10:30 a.m. Did I mention you can join us for Alex's party at 10:30 a.m.? We would really love to see you there. I'll be there. Alex will be there. Raise your hand if you're going to be there. All right, we've got a few folks. We would love to have y'all there. So the poll is about to drop. Is our poll live? The poll is live. The poll is live. So please tell us, how do you want to plug into the work, right? So number one, do you want to host a casual party? 2, meet up at Alex's brunch party on September 14th at when? 10:30 a.m. Or do you want to support a party, right? Help with setup, help with food, help with costs. We know that different people need to tap in different ways. Whatever you have, bring it to it, right? Bring it to this movement. If you are great at baking, please bake us some cookies, bake us some quiches, do whatever you want and whatever it is that fills your soul and maybe even fills our bellies, right? We need to fuel this movement. And so whatever it is that you get down with, whatever your talents and gifts are, please bring it. We need it here. We welcome it here. Let us know how you would like to tap in. And additionally, if you want, you can join a working group. Please select how you can tap in. We'd love to see these answers come through and to see how you want to tap in. And we will be in contact with you afterwards to follow up on these things. Because we need you to jump into the work, right? We know that we are fresh out of the summit and many of y'all were there, and we are happy that you attended, and we helped to develop that. We were a part of it, and we need you to stay tapped in through an organization such as ours. So continue to plug into this work. Please show up to the party, fill out that poll. We'll follow up with you. And then Gus, the youngest member of healthcare for us, is going to tell you about one other way that you can help us out. Take it away, Gus.
Hi, my name is Gus. I support CalCare because when we take care of people, we respect them. Paul is going to put a link in the chat to donate if you're able to. If you like what we're doing, please put 5 on it.
Hey Gus, are you gonna put 5 on it?
Yeah, I'm gonna put my September allowance on it.
Buddy, thanks so much. Great job. Do you want to kick it to Gina for Q&A?
Yeah,
Yeah, say I kick it to Gina for Q&A.
I kick it to Gina.
That's not fair. I have to follow the cutest presenter we've ever had. Oh, thank you, Gus. And I'm going to put 5 on it too right now. Okay, folks, let's go back to gallery view. I know we had a question very early on in the chat for you, Alex, when you put up the chart comparing the insurers. I think it was Diane asked about Kaiser, where Kaiser landed in any of that. I don't know if that came up in your research.
You know, Kaiser is not one of the programs that is quoted for these policies because it's all in network and not all of the employees for this company have access to Kaiser, in my understanding. So it's not one of the ones. But I don't think, I mean, I guess I would ask a follow-up question, which is, what would it matter for Kaiser? What I know Kaiser is its own specific system, but in terms of the costs of health insurance premiums, regardless of what insurance provider we're using, the costs of premiums are very high and then come with additional costs. Is there an additional part of that that maybe I don't understand?
Diane, do you want to unmute and clarify your question? Are you still with us?
Yeah, I was just curious because it is a kind of a different system, but yeah, the premiums are very high. And there are occasionally co-pays, though for the most part you don't pay when you get there. So it's the closest thing that I've ever seen, and of course I was born with Kaiser, to single payer, but I still, even on Medicare, even with Kaiser, I'd rather have single payer.
Well, and also to your point, thank you for sharing that. And to your point, you keep all your doctors at Kaiser, right? So your care doesn't
Yeah,
change, only who pays it.
yeah, yeah.
And if folks want to raise hands, I can call on folks if you have other questions for anyone and anything you've heard here tonight.
Gina, I see in the chat, Lindsay Morin has a question. I'll just read it out loud. Does anyone know why people sign up for Medicare Advantage? What is the incentive? I can take a stab at that and then turn it over to some other board members. Um, well, for one, they run ads, and the ads are pretty enticing. It's also very confusing. A lot of people signing up for Medicare Advantage think they're signing up for traditional Medicare. They're not even aware that there's a difference. And they'll offer incentives like I think it's called Silver Sneakers workout program like at YMCA's and things like that, or all the MRIs you could ever want. I mean, they run these like weird promos. And so people think that they're getting something, but what they don't realize is when they need long-term hospitalization or serious surgeries, Medicare Advantage doesn't cover that. They get stuck with huge bills. So that's a little bit of an answer to it. I don't know if any other board members want to add on.
Actually, Ryan Skolnick would like to speak
Oh,
to it.
yes, please.
Please, Ryan.
Let's just say Ryan Skolnick is with the California Nurses. So excited to have him here tonight.
Hi, I'm not speaking to you as a CNA member right now, though. I'm speaking to you as someone whose mother-in-law just recently signed up for Medicare. So like Erica said, there's a lot of advertising, but not just in the terms of TV ads. Tried like 50 calls a day during her enrollment period from Medicare Advantage plans offering her, hey, we can offer you this, we can offer you that. Um, and the problem is, at face value, Medicare Advantage is a better deal because they're legally required to cover all the same benefits traditional Medicare is. And they are allowed to offer more benefits. Like sometimes it also includes Part D coverage. Sometimes it pays for more, so you don't need a Medigap plan. Sometimes it does offer things like the gym, but what they don't tell you, and they'll never tell you, is that Medicare Advantage also engages in prior authorization that traditional Medicare does not. Meaning, if you never get sick and never need health care, Medicare Advantage is great. But the moment you're sick, you'll find yourself having to fight for things that you wouldn't have to fight for if you just had regular Medicare. And you can't, and it's very hard to jump from Medicare Advantage to traditional Medicare. So they scam you into offering you a deal that you only get if you are not in a position to take advantage of it.
Thank you. Thank you so much for jumping in there, Ryan. Gina, how you doing monitoring the chat?
I'm fine. I'm just a little distracted because you're texting me too. I was trying to cue that up. So Katrina had a great question in the chat. Is there a strategy for pressuring folks like Katie Porter who say they won't support CalCare because they view it as a distraction from nationwide level single payer? This is so layered. I mean, I'll start with a very quick and simple. Hey, Katie Porter, you were in Congress for a while. I didn't see you force the vote on Medicare for all when you were there. So it's pretty rich of you to be speaking to it now as not being able to do it in California. That's my 2 cents.
I love your 2 cents. I want to say this is opposition tactics right here. So remember, I said earlier, the 2022-2024 CalCare trial runs gave us their playbook. This is right from their playbook. So, whenever we have a state bill, well, let me just clarify. We support national single payer. When we have a state bill, all of our focus is on the state bill because we know, like I shared, just about every social justice victory happens at the state level and the nation follows. It really doesn't happen from the nation down to the state. But this is a very clever opposition tactic, and you see this coming from a progressive Democrat. So I'm really glad you brought this up, Katrina, because it's such a great example, and I see that Gus agrees. So thank you for that, Gus. Um,
Hey, Erica, can I
yeah,
add something that I just thought?
please.
Thank you again, Katrina, for that question. But also, Erica, with your answer, when Roe was overturned, now we see all these efforts at state levels to guarantee reproductive justice and access to abortion rights. So, to your point about Katie Porter, you didn't do it at the federal level, but also our people need this. So, if we aren't going to have it at the federal level, then we have to do it at the state level.
Does anybody else want to weigh in on this? Um,
Just uplifting what I believe Paul dropped in the chat too is that there's a saying in policy work that where California goes, the rest of the country follows. And so that's true for this as well. And so we know that if we can show that California, with as big of a population as we have, right? Now, mind you, we also have a very large economy, can do it, right? Then so can everybody else. Also, what I will say, sorry, one more thing, is that California has a super majority. So we are poised and ready to be able to do this, right? Democrats have a super majority. Democrats have a super majority in both houses and have a Democratic governor. And we have a governor who ran and won on single payer healthcare. So who better to do it than California?
Yeah, any other questions? I'm seeing that Betty Yee's being supported by the Progressive Democrats of America because she supports single payer. That's wonderful. Thank you for that, Lynn. And a shout out for Dr. Butch Ware, who's running and absolutely supports CalCare. And if you look at his website, his plan is to declare an healthcare emergency in the California and implement CalCare in the first 100 days, going around the California legislator to do it. So not sure how legal that is or how much, but I'm not really sure what's legal anymore anyway. Any other questions? Oh, I see your hand, Lynn.
Hi, thanks for your meeting. I'm really enjoying it. Yes, I am a CNA researcher, and CNA is doing huge efforts to address organizations that support Democrats, unions, etc. We're trying to target certain Democrats, getting organizations that endorse them to support single payer. And they have actually conducted in-person meetings with new Democrats, freshman Democrats, to see if they support single payer. And I believe Patrick Aaron up here it agreed to support CalCare. So from various standpoints, CNA is doing a huge effort. I'm also researching schools. They're looking at all the student groups. I did Chico State, I've done Fresno State, and they have all kinds of different, clubs, diverse and such, and try to get students at the youth level involved because they're the population that don't know that much about single payer. So I'm excited to be part of this project, to see CNA branching out finally.
Great. That's great information. Thank you. And it just excites us all the more, that the momentum is building and bill after bill, and we're going to have another bill next year. So, we're definitely on that train and glad to see all the organizations. I mean, I think it was 243, Ryan, small businesses signed on last year. Like, it's coming around the mountain, as they say. There's a question from Alice in the chat, and then I'll go to you, Cheng Sim. CalCare started with a plan to have a trust fund that contains California's Medicare, Medi-Cal funds to pay for single payer. If that's still the plan, could Trump find a way to shut it down? Oh, Ryan answered it in the chat. Thank you, Ryan. I'll read it out loud for folks. It's easy to deny a waiver, but it's very hard to revoke a waiver once it's approved. But we wouldn't be implementing this during the Trump presidency. We'd just be passing the policy bill, once again, and waiting until he's gone to move forward with the waiver. Thank you, Ryan.
So,
Sheng
Gina,
Sim.
can I weigh in on that? Again, this is another opposition tactic, right? So we have one, oh, I don't want to support it at the state level because it'll hurt it at the national level. Not true. You pass it at the state, the nation follows. Doesn't hurt, helps. Makes it happen, actually. Just like every other social justice victory. This is another one. Oh, we can't because Trump is, I would support it, but since Trump is president, we won't get the waiver. This bill is a policy bill that has to be passed first before we get to anything having to do with the federal waiver. So Trump has nothing to do with this. The feds have nothing to do with this. This is all California. We just have to pass this policy bill. So again, that is an opposition tactic. Back to you, Gina.
I dropped a fun little video in the chat for everyone. Cheng Sim, go ahead.
I just wanted to address 2 points. First is the opposition that has been suggested in certain quarters that somehow, state single payer is not possible, and only national single payer is possible because of ERISA and all that kind of stuff. So that argument is actually bogus because the state single payer bills, including CalCare, there are workarounds. I don't want to get into too much into the weeds, but the two previous CalCare bills had workarounds so that ERISA was not affected. So don't believe it when people say to you, you can't do state single payer, you can because of ERISA. That is bogus. And then the second point I want to address was in terms of electoral pressure, it's not good enough to get candidates for office to say they endorse single payer or they support single payer. We've all seen what Newsom did. He said to high heaven he was a single payer supporter, and that first thing he would do as governor would to bring a single payer to fruition. So lies, lies, lies. So candidates can say they support single payer, but then when they get elected, they back off, because they're trying to keep their donors happy. So when we do power mapping for any kind of electoral, on the electoral side, the work can't stop if the person that you've gotten to say, yes, I support single payer, gets elected. The work really begins once they get elected to make sure that they are held accountable. And the power mapping that we do, if we pursue the electoral path, it must include targeting any, and it doesn't need to be like, we don't need to target a lot of people. We need to pick one vulnerable elected official who broke their promise. They broke their promise. We had to do what APEC does. Like APEC does a lot of, has a lot of money, but we have to do it. We can't. It's not a money game for us, but it's a people game for us. That we need to pick the most vulnerable person who lied to us about the support for single payer and make sure they get defeated. To send the message that we ain't gonna play with you. Right? You will suffer the consequence of lying to us. So that calculation needs to be part of any kind of electoral uh, um, plan or path.
Well, thank you, Chang Sim. Appreciate that. We do like to keep our promises and get everybody out on time. We are just a few minutes over. Again, we really appreciate you coming tonight. Let's go ahead and see the results of our poll before we close. Um, Amazing. Amazing. Lots of people ready to jump in the work right now and join a committee. And so many of us are coming to Alex's house in our
Woo!
pajamas for
Hey,
brunch.
can I just add? It's legit casual party. I told some of my friends, come in your pajamas if you want to, right? We're gonna have food and mimosas and coffee, and it's gonna be great. And you're all welcome. We'll send you the info for those who selected that, but please come casual.
Thank you, thank you, thank you, thank you. Thank you, Paul Newman, for dropping the links. Again, there's the link to volunteer, join one of those working groups in the chat. There is a link to sign up for our newsletter, and of course, a link to donate. This is the end of our formal meeting. We are going to stay on Zoom for about another 30 minutes. If there are any other questions or things people want to share or just talk about, but if you have to go, you're welcome to leave and enjoy the rest of your evening. We're going to stop the recording now.